Hello, this is Dr. David Green, CEO of the California Pain Network. Today's topic is the basics of sciatica. Sciatica occurs when one of the nerve roots of the sciatic nerve gets pinched. Looking at the sciatic nerve, it's actually a confluence of three nerve roots at the lowest part of the back. So you can see here, looking from the front, L3, L4, and L5 actually come together to form the sciatic nerve, which then runs down the back of the leg. At any one point in time, 1 to 2% of the population is suffering from sciatica, and it's most commonly due to either a herniated disc, which is pinching on a nerve, or from spinal stenosis. Less common reasons can include nerve root irritation from degenerative disc disease, maybe a tumor, or a problem in the nerve root itself. So when a disc degenerates, the outer layer may tear. So here you have a disc, and it's akin to a jelly donut. You have a gelatinous inner portion and a harder outer portion. If that tears, the inner jelly can squeeze out and can pinch an adjacent nerve root. Okay? This does not in itself cause pain, but it's the inflammation that sparks up that can cause sciatica pain to shoot down the nerve root. It can also cause weakness. For instance, it can cause difficulty with lifting up your foot if the L5 nerve root is pinched. So when disc degeneration occurs and you don't have a disc herniation like this, it can actually spark up inflammation in this area, which can seep over and actually cause sciatica too. So you don't even have to have the pinching here to have sciatica pain. Symptoms may vary with sciatica. A person may have a burning pain. It can feel like an electrical sensation. It can be pins and needles, possibly some numbness thrown in there. You can actually have motor weakness as well, as we mentioned, a foot drop where you have trouble lifting up your foot possibly. And rarely you can have incontinence, and that becomes a surgical emergency. It's called cauda equina syndrome. It's very unusual, but it's an emergency. It's an absolute got to have surgery right away. How is sciatica diagnosed? Well, history and physical exam are key. An MRI can be extremely helpful. That's pretty much the gold standard. A nerve conduction study can be helpful if in fact the MRI is negative. And then a diagnostic injection. If a diagnostic injection relieves the pain and you don't see a disc herniation, then you can still be reasonably assured that possibly there's degenerative disc with some chemical inflammation. This is called a straight leg raise test. The patient lays flat. You lift up the leg while it's straight. If the person has a pinched nerve, the sciatic nerve gets tensed, and it can be a real exacerbation of the pain. And then when the doctor bends the knee, it takes tension off the nerve root, and a lot of times the pain goes away instantly, and that's very indicative of a disc herniation with sciatica. Here you have a disc, and there's a herniation here. It's very large, and it's pinching on the spinal cord and one of the nerve roots trying to get out. Okay? There are several treatment options for sciatica, and this is great because over 95% of people with sciatica can be treated non-operatively with some of these options. Limited bed rest has been shown to be better. It used to be thought that like a week in bed would be best, but now we know that's not the case. As little time in bed as possible because getting up and being active is shown to be better. Medications may include over-the-counter non-steroidal anti-inflammatories, Tylenol. Muscle relaxers can be helpful. Neuropathic medications may include Neurontin or Lyrica. Those can help with that nerve-type pain from sciatica. And short-term opiates can be helpful as well. Treatment with physical therapy and or chiropractic can be helpful and have been shown to help with the pain. TENS units, such as you see here, are an excellent low-risk way of getting relief. It's about the size of an iPod. It's run off a battery, and these foam pads go over the skin and provide slight electrical impulses that can help with muscle spasms and pain relief. Acupuncture has been shown in several studies to be excellent for sciatica pain treatment. Spinal decompression therapy has been a revolutionary treatment that is FDA cleared and has been in use extensively over the last decade. Basically, it's about 20 sessions, about half an hour each, involving intermittent computerized spinal traction. And it's been shown to be about 85% effective. Interventional treatments may include trigger point injections. These are subcutaneous that can help relieve muscle spasms and aching. And the gold standard interventional treatment is epidural injections, such as you see here, where the needle goes very close to where the nerve root is being pinched. and then it delivers soothing steroid medication that bathes that nerve root and helps relieve that inflammation we were talking about. What are the outcomes with sciatica treatment? Well, thankfully, over 95% of sciatica patients are successfully treated without surgery. There was a landmark study in the Journal of American Medical Association in 2006 that showed that the one-year outcome between operative and non-operative patients was absolutely identical. So if pain relief can be effective for the year, then you don't need surgery and the outcome is expected to be identical. Now, what are the indications for sciatica surgery? Well, absolute indication would include Cauda-Equina syndrome, which we talked about earlier, which would include incontinence. This you need to get to right away, definitely within 24 hours. If you start to develop muscle weakness due to the pinching of the nerve, you don't have to have surgery right away, but you shouldn't watch that forever. If in fact it goes on for 6 to 12 weeks, if you have even technically perfect surgery, there becomes a time when it's not reversible. So that needs to be considered when you're watching muscle weakness. And if 6 weeks of failed non-operative treatment or more has gone by, then it's time to start thinking about surgery. California Pain Network offers the top non-operative pain treatment throughout the state. There are lots of clinics throughout California, including San Diego, Oceanside, Orange County, Los Angeles, Bakersfield, San Francisco, Inland Empire, and a lot more. The clinics accept over 50 insurance plans. There's over 25 treatment options and over 90% success rates for all types of pain conditions. The pain doctors are board certified. They're award-winning. Check us out today online at CaliforniaPainNetwork.com and then call us at 877-877-8556. I'm Dr. David Green with the California Pain Network. Your pain stops here.